Ma'am. Today I'll be presenting on primitive reflexes since we've been getting a lot of kids with developmental delays and genetic conditions. Primitive reflexes are a very important part of our evaluation for such children who have motor delays in their development. So, what are primitive reflexes? Primitive reflexes are involuntary motor responses originating in the brainstem present after birth and early childhood development that facilitate survival. So the kids usually have show these reflexes in the first 6 months of their life predominantly, and they're important in those months because they are there for the survival of the child. After that, they are supposed to get integrated, but in the first 6 months, these primitive reflexes are very important. Several reflexes are important in the assessment of newborns and young infants. So these give us an indication of whether a child will go ahead and have a motor delay or the child will have some other condition. So these give us the indication of further development of the child. These central nervous system motor responses are eventually inhibited by 4 to 6 months of age as the brain matures and replaces them with voluntary motor activities, but may return with the presence of neurological disease. So there's a principle of normal development which says that it goes from reflexive behavior to voluntary behavior. So just to give an example, all of us can grasp things with our hand. So palmar grasp is one of the primitive reflexes that a child has. The only difference between the palmar grasp of a baby and that of ours is that ours is voluntary while theirs is reflexive. So if you touch their hand, they'll always flex it. That is important because in that age, they're supposed to grab onto things, get those textures for their sensory development. So they need to have that reflexive thing that they need to grab everything. But as we grow and as we develop, it slowly becomes voluntary so that we don't like hold every object that comes in our hand, but we can choose and decide what we want to hold and what we don't want to. So if the reflex persists beyond 6 to 7 months, then the child will just be grabbing everything and not actually exploring and developing their brain. So that is the difference. It has to always go from reflexive behavior to voluntary behavior. So primitive reflexes are necessary for newborn survival and abnormal reflexes can be a sign of central nervous system dysfunction. It is important to understand how to correctly elicit these responses for early diagnosis of possible lifelong complications. The adult reemergence of primitive reflexes indicates the potential for several brain pathologies. These may seem these may be seen in the normal adult as well, but require further exploration if a pathology is suspected. For example, there is the glabellar tap reflex. So if we tap on any of our foreheads near the glabellar region, we'll all close our eyes. So that corneal reflex, all of these are normally present in us. But if there is some abnormality in any of these reflexes, it is indicative of a upper motor neuron or a brain pathology. So in adults also, if we see the grasp reflex, if we see the Babinski sign, all these gives us an indication that there is some brain pathology that is going on. Clinical significance in infants. Primitive reflexes are important in the newborn neurological examination and absent. So they've given from a lot of studies, they've given certain examples of certain reflexes. An absent or abnormal sucking reflex is an indirect indicator of neurological maturity in newborn infants. So all kids are supposed to have the sucking reflex because the first thing they need to do is have milk. So for which they need a sucking reflex. So if that is not present, that usually shows that there is immaturity, like the neurological system is not developed, or even the sucking reflex develops at 28 weeks of gestation. So a premature child less than 7 months will not have the sucking reflex because it has not been developed only. So these kids in the NICU, then they need training for the sucking reflex to develop. Then Moro's reflex is weak in preterm infants compared to full-term infants due to their poor muscle tone. and resistance to passive movements. This response correlates with the delay in motor development in very low birth infants. The absence of the Moro reflex suggests CNS dysfunction. So we'll be discussing these reflexes in detail. Then I can comment more on it. Persistence of primitive reflexes past 4 to 6 months or absence before this time when they should have been present is predictive of cerebral palsy. The presence of five or more abnormal reflexes correlated with development of cerebral palsy or mental delays. So certain studies say that if five or more of these abnormal reflexes are present, then the kid most definitely has cerebral palsy, but of course it has to be correlated with the investigation. In adults, primitive reflexes are also known as frontal release signs. That is, when the frontal lobe is not intact and it is not controlling, then the primitive reflexes take control. Because the frontal lobe is the most evolved one. So once its influence is taken away, then the primitive reflexes become stronger. So it has been seen in many neurological conditions like Alzheimer's, dementia, multiple sclerosis, schizophrenia. They tend to have a reemergence of primitive reflexes. Patients with schizophrenia were found to have more frontal release signs than their unaffected siblings and control group. Another study detected grasp and Babinski reflex responses in patients with dementia. A present Babinski reflex is important in evaluating a suspected pyramidal tract lesion and an upper motor neuron. So, Babinski sign is something we check in all neuro patients. The reappearance of the grasp reflex has been associated with frontal lobe lesions and can be seen in corticobasal syndrome, Lewy body dementia, and progressive supranuclear palsy. So, basically, an adult or a kid with neurological condition has to be checked for primitive reflexes along with deep tendon reflexes. So only that is not enough. We have to check for the primitive reflexes as well. So there's no fixed classification of reflexes that is given. Matlab, there's no one common one that is used for anything. But there are these, we can divide them according to where they come from or where they originate and where they develop in. So this is just to simplify our presentation so that we can see them under a classification. So there are five that we'll be discussing: automatic reflexes, spinal cord reflexes, brainstem reflexes, midbrain, and cortical reflexes. So in the automatic reflexes, we have the Moro's reflex, Landau's reflex, Gallant's reflex, and the parachute reflex. So the first one we'll discuss is the Moro's reflex. So Moro's reflex will develop at 28 weeks of gestation. So when the baby is in the womb, that's when it starts developing, and it should be integrated by 3 to 4 months of age. So, and definitely not elicited after 6 months. So, if it persists beyond 6 months, then it is a definite sign of a pathology. So how to elicit it? You have to keep the baby in a midway position from supine lying to sitting, somewhere in middle. So a transitional sitting phase, they have to be in middle, and you have to slowly, like you have to stretch their anterior neck muscle. So their head will be taken into extension, a quick extension. So what the baby will do is their shoulders will abduct, the wrist is flexed, and the sorry, wrist is extended, elbow is flexed, and their fingers are open. So the baby goes in this position that you can see in the picture, and then immediately they are supposed to bring it back into flexion. So this is a protective reflex that if the baby's head ever goes back, it has supposed to grab onto its parent. So it's a protective reflex that the kid has till head holding develops. That is why it is supposed to get integrated by 3 to 4 months of age. So if the baby is not able to take it properly out and in, so either there could be a weakness, there could be hypotonia, or there could be hypertonia due to which the hands are not able to go. If it is asymmetrical, then there could be a peripheral nerve injury or a brachial plexus injury. So then further investigation is needed in such cases. The second thing is the Landau's reflex, which we can see in this picture of the baby where the baby is prone. So you have to hold the baby in ventral suspension or prone position, and the baby, and you have to wait till the baby shows some movement. So the neck is supposed to go in full extension, the hands are supposed to be extended, and the lower limbs are also supposed to be elevated. The baby is supposed to come in a Superman position. So this reflex develops by 3 to 4 months of age. The peak will be at 8 months, and if at 10 months it still persists, then it is pathological. So this shows the development of the baby. When the baby is born, the baby will be in a full flexed position. And slowly, as the head holding and upper limb, lower limb development starts, by 8 months or so, the baby will come into a full extension. After that, it becomes voluntary. So it's not like the baby at 1 year shouldn't like just go into extension when we hold the baby in this position. After that, it's voluntary. The baby can do whatever it wants to. So if it's still doing this reflexively, then that is pathological. So why the Landau's reflex is needed is that the baby needs to achieve head holding and the upper limb and lower limb maturation. The Gallant's reflex, we can see in the picture on the right side. So the baby will be in prone position, and we have to stroke the paravertebral region, that is just alongside the vertebrae, from our C7 bone to the buttocks. So we have to give gentle strokes, and the side that we have stroked on, the baby's trunk will lateral flex towards that side. So this is a reflex created for the baby to localize where the stimulus is, but it should get integrated by 6 months of age. Otherwise, the side that is showing this reflex will go into scoliosis, because the baby, by the touch of clothes or by the touch of the bed, will constantly be lateral flexing to that side, and it will go into scoliosis. Then there is the parachute reflex. So the parachute reflex develops by 6 months of age and remains for life. So even if any of us are pushed, we tend to keep our hands on the ground. That is basically our parachute reflex, that while we are falling, we know that we have to support ourselves with our hand. So if you take a baby and you forcefully push it into front position, its hand should come out and support itself. So that is the parachute reflex, which will develop by 6 months once the baby has gone from its flexed position to extension of the arms, and then it can support itself. And this will remain throughout life. So the next set of reflexes that we are going for are the spinal reflexes. So we are going to discuss 8 of them: flexor withdrawal reflex, extensor thrust, cross extensor reflex, palmar grasp, plantar reflex, sucking reflex, rooting reflex, and primitive walking. So these next set of reflexes play a very important role in when the baby will start crawling, when the baby will start walking, will it be able to eat properly. So these all play a factor in commanding those things, the basic movement and oral development. So flexor withdrawal reflex starts, it's present since birth, and it should get integrated by 2 months. So the first picture that we see here, where the baby will be lying supine, they have shown the baby's neck turned to one side, but any of our reflexes, when we are evaluating, the baby's neck has to be in a neutral position always. So baby will be in a neutral position, then you have to stimulate the sole of the foot. And if the foot that you've stimulated goes into immediate flexion, that is not controllable by the baby, which is a reflexive behavior, then that is flexor withdrawal reflex is present. This is important to save the baby from any injury. So it's a reflex that has been given to the kid to just protect it from any, like suppose it touches something hot, or it touches something that could harm it, it just has to go into a reflex. But after 2 months of age, it has to get integrated, because if this continues, we see that kids cannot stand, because every time their soul is stimulated, they'll just go into flexion. So it will hamper their standing, their crawling, all of their behaviors, because all these movements require certain amount of voluntary flexion and extension. Second thing is the extensor thrust, which is again the baby will be in the same position like this picture, but the leg will be flexed, and then you stimulate the sole of the foot and it will go into extension. Again, this is present at birth and needs to be integrated by 4 months, because after that, the baby needs the flexion movement. If it's always in extension, even that is not good for the baby. So the leg, when it is extending, it will go not just into extension, there is adduction, internal rotation, plantar flexion. So excess of this movement again shows us that the baby might have spasticity. And if it is not elicited in this range of birth to 4 months, then we can also think of the baby being hypotonic, because the reflex at that age should be strong. Then we have cross extensor reflex. So cross extensor reflex again. So you have to stimulate the foot of, keep the foot flexed, full leg flexed, and stimulate the foot, and the opposite limb will extend. So you keep both the legs flexed and stimulate the foot of one leg, and the opposite leg will extend. So that is cross extensor reflex. Again, hampers with the baby's crawling, because they need a dissociative movement for crawling. So even if one foot goes down, the other one will extend immediately and the baby will not be able to crawl or achieve a quadruped position. Then palmar grasp. So palmar grasp, again, okay, first we'll just talk about the plantar reflex. The plantar reflex develops at 10 weeks of gestation and then it continues till 10 months. So the plantar reflex, the foot, if you stimulate. So just like you can hold the baby's hand and the grasp happens. Similarly, if the foot, if you stimulate, all the toes will go into flexion. So you see it mostly in spastic babies. So they always tend to keep their toes flexed of their feet. So it's the plantar reflex that has not been integrated. So coming to the palmar grasp, it starts at 10 weeks of gestation, integrates by 10 months when it is replaced by voluntary grasp. This is the very initial fine motor development that happens in the baby. So the testing position again remains supine. Their head is in neutral and hands are free. We have to place a finger like how shown in this picture, but from the ulnar side, from the side of the little finger. You have to press on their hand and they will immediately close their hand. So the functional use of this is it is the start of the development of grasp. The infant begins to reach for objects, utilizes a crude grasp to hold things. So if there is an exceptionally strong grasp, then it could be indicative of spastic CP. And it might, if it is asymmetrical, then we can think that it could go into a hemiplegic kind of cerebral damage. And persistence beyond 10 months indicates spastic form of cerebral palsy. Then coming to the sucking reflex. So the sucking reflex is it's developed at 28 weeks of gestation and it integrates by 3 to 6 months of age. Again, the baby is in supine and you have to place a finger touching the upper palate of the baby in the mouth and a rhythmic sucking movement will be seen. So persistence may inhibit voluntary sucking. So till the age of 3 to 6 months, the baby has to have it because the first 6 months the baby is on breastfeeding. So sucking reflex is extremely important. But beyond that, if the baby, every time you place an object in its mouth, if it is sucking, then that is wrong. It has to be voluntary. After 6 months, the baby can decide if it wants to suck or not. So it has to go to a voluntary movement. Then the rooting reflex. Again, onset is at 28 weeks of gestation for both of these reflexes, which is why babies more premature than like less than 7 months, they do not have these reflexes. So rooting reflexes on all four corners of the mouth. If you place a finger and take it out, the baby's head turns towards those directions. It is again to locate the nipple that the baby has these reflexes. So it should integrate by 3 months of age and uh, like persistence can interfere with their voluntary sucking. So every time the cloth brushes or anything happens, they'll just go and these sucking and rooting reflexes also depend on the hunger level of the baby. If the baby is hungry, then these are elicited more quickly. If he's not hungry, it tends to be elicited more slow, or like less quickly. Like it might be slow. The sucking may be slow. So these reflexes we see in the NICU and are used to train premature babies. So if they're hungry, that's what we have noticed, that they suck very strongly. And if they're already fed, then they suck very gently. And the last thing is primitive walking. So if you hold the baby in a standing position and touch the dorsal part of their foot to a object, they'll immediately show a pattern of walking. This again needs to get integrated by 3 to 6 months, because beyond that the baby has to start its basic steps that it has to start for walking. So the foot needs to be on the ground. And a baby who's showing a developmental delay will usually walk in a toe to heel fashion, like its toe will go down first, whereas a normal baby will keep the heel first. So they show a proper walking pattern, but again it is reflexive, it's not something they're doing out of their own. Then brainstem level reflexes, again seen in kids with developmental delay. So the first one is symmetric tonic neck reflex. So the one you can see in the left corner. So what happens in this reflex is, if you've held the baby in ventral suspension and you extend the neck of the baby, then the upper limbs go into extension, lower limb goes into flexion. Whereas if you flex the neck of the baby, the upper limbs will go into flexion and lower limb will go into extension. The onset of STNR is 4 months and it will get integrated by 6 months. Um, so when this happens, it is necessary to achieve quadruped. So when the baby's neck is in extension, the hand has to be extended and the legs have to be flexed. So this helps you in achieving the quadruped position. It eventually has to get integrated for movement to come, but just to hold the position, STNR is sufficient. And if there is an excessive STNR response, then the baby will fall down rather than achieving the quadruped position. So it has to be in an adequate amount. So if the baby is spastic, again, it will be hyperactive, like the STNR will be too strong, and then it won't let the baby come out of that flexed position. Coming to ATNR, asymmetric tonic neck reflex. So in this reflex, again, it starts at 2 months of age and integrates by 4 to 6 months of age. Um, so when the baby's head is turned to one side, for example, the left side, then the right side upper limb and lower limb go into flexion, and the left side upper limb and lower limb will go into extension. Uh, so, so these things, the functional significance is persistence of this reflex may indicate CNS damage and disrupts movement, because if ATNR is persistent, then the baby's one side is automatically in flexion and cannot be showing voluntary movement. And opposite side is also an extension, the baby can't use his limbs. So it's a very strong reflex which doesn't allow the baby to do voluntary movement. Then tonic labyrinthine reflex, it's the one on the right side. Tonic labyrinthine reflex, just a second. Midline activity like rolling over and all does not develop if the baby shows persistent labyrinthine reflex. It should be integrated by 3 to 4 months of age. So either supine or prone can be shown. So the first picture shows us supine. So when the baby is in supine and the head goes into extension, then the upper limb and lower limb both go into extension. Um, so so upper limb, lower limb both go into extension, and it will, and when the neck is in flexion, both will go into flexion. And when it is in prone position, then again extension goes with extension and flexion will go with flexion. So if the baby remains in this position, midline activity rolling over does not develop. Then positive and negative supporting reaction. So if you're holding the baby in a standing position and you are just gently bouncing it up and down, then the leg will go into extension. So that is our positive supporting reaction. So the baby's weight is supported on the leg. At the same time, if the baby is standing like that and you suddenly lift the baby, then the legs will go into flexion, which is negative supporting reaction. Then going on midbrain reflexes. So optical writing reflex, neck writing reflex, body on body, and body on neck. So optical writing reflex is when you turn your head to one side, the eyes go with the head. That is optical writing. So if the neck eyes are not able to do that, that means the ocular muscles have a palsy or they have a weakness. The neck writing reflex is when you turn the neck to one side and the body turns by itself. That is neck writing reflex. So if you turn the neck to the left side, the body will also turn to the left side. Body on neck is the opposite. If you turn the body to one side, the neck also should follow and turn to one side. And body on body is if you turn the pelvis, then the upper body also turns to the same side. So these things remain for life. They develop at birth and they remain for life. So even while treating adult patients, we can see that if they do not have rolling, for teaching bed mobility, we can use all these reflexes. Then the last one is cortical level reflexes. So equilibrium reactions. So equilibrium reactions can be tested on a balance board or the ball. So when you're going, your trunk has to go in the opposite direction. So if you're pushed backward, you have to go forward. So it's the basic thing. So your ankle strategies, hip strategies, all those can be tested on an unstable surface to check whether you have those reactions. These are not exactly primitive. They will remain for life and we all should have it to maintain balance. And the other reflexes are blink reflex and doll's eye reflex. Blink reflex is when you again hit your center of the forehead unknowingly. If you're conscious, it's not going to happen. So you blink, or you put something in your cornea, you blink. So these are protective reflexes that exist. Again, doll's eye phenomenon is if you're turning your head to one side, then the eyes sometimes tend to lag if there is a pathology. So if your head has turned to the left side and your eyes are remaining here, that means your reflexes is not in, like your optical writing is not intact. That's doll's eye phenomenon. So we see dolls that if we turn their heads, their eyes remain to one side. So that is a pathological reflex. So that is it. These are the primitive reflexes that we had to discuss. Thank you.
Perfect. So beautifully narrated. It was the
Amanju,
most perfect thing, Ritika. All the pictures, narration, slides, and everything.
thank you, ma'am.
You can stop recording.